One big difference would be for gestational diabetes is that your hormones of pregnancy tend to be higher in the morning that your placenta is putting out. So you have to be very specific with the foods that you're eating. So in general, for breakfast, a lot of times women can't tolerate hardly any carbohydrate source at all. Or if they do, it's more of like a whole grain starch versus like a healthy diet. We might incorporate fruit in the morning time. And really, I don't incorporate that in with any of my clients in the morning time unless, we see that they try it and their numbers are okay, or they're exercising in the morning with their, after they've had their breakfast. And so their numbers probably will be naturally lower. I don't incorporate that in. And, we limit how much overall like portion size amounts that you can have at one time. So a healthy diet, is being mindful what you're eating, lots of whole grains, more of like a Mediterranean style diet, I would say is very beneficial for risk reduction for type 2 diabetes, but in general for risk reduction for a lot of chronic diseases for anybody. It's a very healthy diet. So I think that's probably the biggest difference that you're going to see is more of like the timing and the portions and specific foods to have and not have for it. And then obviously in pregnancy, your protein needs are going to be a little bit higher too to help support the growth of the baby too. So we'll add a little bit more protein also in to kind of make sure that we're still meeting the energy needs as we cut down a little the percentage of carbohydrate that you're getting from your calories too. So those are kind of just slight changes that you might have. And there might be a little bit more healthy fats in the diet also just to help meet your energy needs while you're pregnant too.